I'm Dr. DeFabio, and welcome to the Natural Way to Better Health and Wellness. Today's show is all about posture. We're going to go over the 3 most common postural distortions and what you can do to improve your posture. So stay tuned so you can sit up, walk, and exercise with better posture. Let's get started with the show. And before we can talk about better posture, why is posture important? Let's cover that first. Well, posture is important because when you have better posture, you're taller. You breathe better, better oxygen to your lungs and organs. When you have better posture, you look thinner, which is always a good thing. And how about your mental health? When you're in a good mood, your head's up and you're alert. When you're in a poor mood, you're slumped and slouched. So when you have good posture, you're telling your body to be upbeat and to have psychologically a better sense of well-being. Beyond that, posture also helps decrease spinal decay. Better posture reduces stress on the joints of the spine and you get less arthritis and decay. Well, what does that mean? That means when you have better posture, let's look at the model here. Spinal decay is when the vertebrae start to deteriorate and the disc wears out. So this is normal vertebrae right over here. 2 vertebrae, the disc, the nerve, healthy. With spinal decay, the disc starts to get thinner and you start to get arthritis. This is very severe arthritis, very severe spinal decay. Poor posture will increase this response from normal to advanced spinal decay. This is a problem because when the disc thins, you start to get pressure on your spinal nerves. The spinal nerves control all the functions of your body. So if there's pressure on the spinal nerve, whatever that nerve does will be impacted. If it's the nerve that goes to your head, you get headaches. If it's the nerve that goes down your leg, you get sciatica. If it's the nerve that goes to your stomach, you get heartburn, agita, indigestion. So we want to slow down the rate of spinal decay because we want to keep your nerves healthier because the nerves control everything else. That's why good posture is essential. And today we're going to talk about static posture, just how you look when you're sitting and standing, but also dynamic posture when you're moving and getting around. So, the first common distortion we're going to talk about today is going to be what they call the upper cross postural distortion. That's this. What's the cause of that? Well, the cause of that's very simple. It's being on the laptop. It's being on your phone. It's sitting slouched in the couch with your feet up in that big C curve because there's a big pillow behind your head. It's called an upper cross postural distortion. This is work by Dr. Vladimir Janda from Czechoslovakia, a neurologist. Really excellent assessment of people's posture and how to fix them. And the problem is pretty straightforward. The chest muscles are very tight. The muscles on the top of the shoulder are very tight, driving us into this posture. All right? And what's weak are the muscles in between the shoulder blades as well as deep in the front of the neck. So to fix that postural distortion, it's going to be a combination of factors. In fact, to fix any postural distortion, it's a combination of factors. Number 1, you need to have full range of motion and flexibility of the area that needs to be fixed. So in the upper cross postural distortion, that means the upper back has to be freely movable. Chiropractic care is essential for that. Using a foam roller, one of these devices, which we're going to show in a little while, is essential for that. Or we can use a more advanced foam roller technique, the myo roller, where the spine gets right in the ridge here and we really can get nice authority on the ribs. But essentially you need flexibility of the area. You can't change the alignment if the joints aren't freely movable. So that's the first thing we want to do, is get the joints freely movable and stretch the muscles that are tight. The second thing we want to do is strengthen the areas that are weak. For an upper cross postural distortion, the strengthening means your mid and lower traps. Again, at the end of the show, we're going to go over these exercises specifically. But it's about strengthening the muscles in between the shoulder blades. If you look at this diagram here, you can see what we're talking about. These are the muscles that need to be strengthened to pull the wing bones back and down, not just back. So stretching the chest muscles is important. Stretching the muscles on the top of the shoulders is important, but strengthening those mid and lower trap muscles is important. And lastly, we need to integrate it with your everyday activities so you can sit up, stand, walk, move, talk, breathe with normal, good posture in a controlled alignment. So, upper cross postural distortion, one of the most common distortions out there. It's fixable with a combination of chiropractic care to get the thoracic spine, your mid-back freely movable, using a foam roller, and doing the appropriate exercises. Stay tuned because the next thing we're going to talk about is a lower cross postural distortion, sway back, when you get that increased curve or sometimes that flattening of the curve in the lower back. We'll talk about that, its causes, and how you can intervene when we come back. I'm Dr. Donald DeFabio. Did you know that we can treat plantar fasciitis successfully in the office? And it works real well because we use an interdisciplinary approach. At plantar fasciitis, inflammation along the bottom of the foot. First step is to make sure there is no joint dysfunction, pathomechanics in the foot where the foot, ankle, knee, or hip need to be adjusted, so some chiropractic care. Second is to decrease the inflammation in the plantar fascia and to lengthen all of the muscles in through the calves because there's no tension on it down here. You can do that at home using an intracell stick, works really well. Beyond using the intracell stick, in the office we use a procedure called Grafton. We put a little lotion on the skin, just kind of rub it on a little bit as a lubricant. Then we take a stainless steel instrument and we work over the tissues to break down scar tissue adhesions, to lengthen the tissue, and in terms of plantar fasciitis, to create elasticity and to drive blood into the area. And by driving blood into the area, it helps promote healing. We need to work the calves because when the calves are tight, it causes the foot to do this. You go and stand, the foot does that. If this doesn't lengthen, it gets mad. If you still have to be on your feet while this is healing, sometimes we have to prescribe an orthotic, a custom molded footbed that goes underneath the foot to support the arch, and we cut it out a little bit with an extra pad to give you some support over the plantar fascia. And if you have a heel spur, we can do that. So a little bit of Grafton. We'll also stretch it and ice it and stim it in the office. And then our go-to to help you get some really quick, adequate, and effective pain relief is we use a combination of kinesio tape with sports-specific taping, all right, SPRT taping. So a little bit of kinesio tape around the heel and foot, just for a little bit of protection, some support. Then we take some rigid tape, glucotape, around the Achilles, wrap it around, a lot of authority to pull that heel forward. And by pulling the heel forward, it takes the pressure off the plantar fascia. Then we'll do one from the other side. We wrap it around, bring it around, tape it down. And you get that little dimpling effect in through here. We've shortened up the tissues, taking the pressure off the plantar fascia. This can stay on 3 to 5 days, shower with it, bathe with it. If you have to go swimming, we have to do other things to help it hold on if you're a triathlete and just training. So, plantar fasciitis responds extremely well to the integrative approach of chiropractic, soft tissue work, rehabilitative exercises, specific taping, and myofascial release. I'm Dr. Donald DeFabio, and now you know. Welcome back to the show. So we have a concept of posture for the upper back. However, let's take a moment and talk about what is ideal posture. I made that assumption that you knew what it was, but you may not know. So first of all, let's look at this diagram right here. It's going to talk about what is ideal posture. Well, that means your eyes are level, your shoulders are level, your hips are level, your knees are straight ahead. From the side view, your ear is over the shoulder is over the hips are slightly in front of the ankle. So the plumb line of the body goes between the ear all the way down to just in front of the ankle. That's ideal posture. That's where we want to be. That's what's going to help prevent that spinal decay we just talked about. Can you check your posture at home? Well, it's very, very simple. You stand in front of the mirror, or even better, have somebody get out their iPhone and take a picture of you from the front and from the side, just standing normally, barefoot, in something that's that you can see your body. It doesn't have to be with loose-fitting clothes you can't tell real well. Maybe a pair of gym shorts and a girl with a sports top, something like that. So you can see the different landmarks. And you put a little dot in each eye from you're looking straight ahead. Put a dot on each shoulder. Put a dot on each hip. And then draw a line in between them. And that'll tell us if your shoulders are level, if your hips are level. How about from the side? Put a dot on your earlobe. Put a dot right on your arm. Put a dot right on your hip. Put a dot right on your ankle. And connect those dots. If it's one long straight plumb line, good posture. If it's too far forward or too far back, if there's angles in the plumb line, look at this diagram. You can see those angles, poor posture. So that's how you can do a quick, simple home self-assessment just on your iPhone, all right? So now that you know what good posture is, we can start thinking about how posture impacts the rest of the body besides the upper body. It's the middle to lower, in through your abdominal and hips. Most of the time we get an increase of curve. Sometimes we get a flattening of the curve, but sometimes we get a mixed distortion. All right, here's another diagram to look at. You've done your home postural assessment. You may find it's a mixed. Your shoulders are a little rounded and you're off to the side. Your feet are a little turned in and one shoulder is high. So it may not be just one distortion. There may be several. So once you get an idea of where the worst problem is, then you can work forward. But better yet, call me and I'll be happy to set you up in the appropriate exercises for that. Because we're giving you guidelines, but you still need to own this on your own. So, problems in through here. Usually the hips are off to one side, or you're getting what's most common is the pelvis tilts forward. Why? Because your hip flexors, your iliopsoas muscles are too tight. Because we sit in the car, then we sit at work, then we have in this position when we sleep, so we're always cramped up and tightened up. That tightens up the hip flexors, tilts the hip forward. You take a woman, puts her in some high heels, boom, tilts the hips forward again. Creates that lower crossed syndrome. So that's the second distortion. What's the problem? Deep abdominal muscles are too weak. Low back muscles are too weak. Hamstrings, hip flexors have a tendency to be too tight. All right? How do we fix it? Number one goal, strengthen your deep abdominal core muscles. We do that with some bracing and some bridging. All right? Very important you learn to brace and engage those deep abdominal core muscles with some bridging exercises. So before you can fix that postural distortion, you have to fix that. Secondarily, the glute muscles, primarily your gluteus medius and your gluteus maximus. What does that mean? It's the muscle that goes out to the side. It does this and goes straight back. Those are the two muscles that need to be strengthened. That'll pull your hips back and down, all right? So we need to strengthen those muscles. We need to strengthen the deep abdominal core muscles, and we need to stretch. Again, remember, correcting posture is about improving flexibility of the tight areas, making sure the joints are freely movable so they can get into better alignment, and then strengthen the weak areas. For the lower cross distortion, the tight areas are those hip flexors. So here are some simple hip flexor exercises. There's a diagram with a couple of hip flexor exercises on it. And you can see you want to open up the spine and stretch it along the front, okay? You can do it standing, you can do it with the ball, you can do it lunging forward, but opening up the front. You also have to stretch those hamstring exercises, which are back and through here, so you want to get those hammies stretched out, all right? So stretching out the hamstrings through here are very important. Here's a diagram of a couple of different hamstring stretches. By the way, if anybody wants copies of these exercises, just email me. I'll be happy to email them to you, okay, to make it easy. My email address is drdefabio@aol.com. So flexibility, hamstring, quadriceps, hip flexors, and hammies. Strengthening of the core and those glute medius muscles will help you get that lower cross postural distortion in check. So where are we so far? We've done a lot of information, all right? The first thing we've gone over, it had to do with the upper cross distortion. Then we talked about how to do some postural home assessment. Then we talked about what happens if your hips are out of alignment. Well, lastly, we have to talk about what's happening from the feet up. The third most common postural distortion is a lower extremity, something involving the knees, the feet, and maybe the hip joints. We're going to talk about that next after our break. I'll be right back. I'm Dr. Donald DeFabio. Hi, I'm Dr. Donald DeFabio with your wellness tip. Remember that the way you exercise is what you're training your body to do. So if you're exercising with poor posture, you're training your body with poor posture. Chest up, shoulders down, eyes level, hips level. That's the way you want to do all your exercises. Remember, if you're holding onto the treadmill with slumped shoulders, you're giving yourself slumped shoulders. So train with good posture in everything you do, and you have better posture outside of the gym. I'm Dr. Donald DeFabio. Welcome back to the show. It's been all about posture. I'm Dr. Donald DeFabio, your posture specialist, shall we say. So we talked about upper extremity posture. We talked about your home assessment. We talked about the posture imbalances through the mid and lower back. What about the legs? What about knock-knee? What about hips that are shifted? What about feet that turn out? Those all significantly impact the rest of your spine. Take a look at this diagram. It's called the lower extremity postural distortion. The foot rolls in, the knee buckles, the hips become uneven, and it works its way all the way up. It's called serial distortion. In a case like this, we have to figure out where the problem is. Is it because there's an imbalance in the foot? Is it muscle weakness or muscle tightness? So we have to balance the feet. Sometimes we do it with exercises. Sometimes we do it with inserts in the shoes. We use corrective orthotics, foot orthotics. These are just two variations. This one I'm showing you because we actually put a little extra lift on the bottom here. This extra yellow shows us that the patient had one leg that was shorter than the other. So we needed to lift them up to level off the hips, because that's why they had uneven hips and actually some scoliosis, a spinal curvature, because the leg was short. We balanced the leg lengths, the hips leveled, and the spine got straight. But if someone just needs a little support for the arch, we use more of a full-length orthotic that's semi-rigid, not real hard, gives good shock absorption, but a little bit of control through here. So we get control, but we also get shock absorption. Excellent if the arches are starting to drop either equally or, what's more important, unequally. In fact, I had a 14-year-old boy in last night, and we checked how much his arches dropped from not having any weight on his feet to full weight bearing. One side dropped 4 millimeters. The other side dropped 11 millimeters. That's an 8 millimeter difference, which to translate it is almost 3/8 of an inch. That's why his hips were off. So we're going to get him some nice semi-rigid orthotics, keep those arches into neutral position, then give him some strengthening exercises to strengthen those muscles so he can hold his feet up on his own. So that's the lower extremity postural distortion. Very, very important to look at the whole body system. The feet, the knees, the hips, the back, the spine, and then address it with the appropriate exercises. If it needs a brace or a sport and orthotic, with that as well. How do you apply all this with your everyday activities? Well, once you know proper posture, then it's up to you to do that when you're in the gym, when you're doing your weight training in the gym, maintaining posture. When you're on your bicycle, look at this cyclist. That is not good posture. But look at this cyclist, excellent posture. So you can maintain good posture when you exercise. How about when you're walking and running? When you're walking and running, you want to keep the chest up. You want to be leaning slightly forward unless you're sprinting, okay? Arms relaxed, good alignment. You don't want to be running like this. You don't want to be running back like that, okay? If you're a sprinter, you get to lean forward a little bit more than if you're just going for a light jog. But it's all about proper alignment. What about in the gym and you're on the treadmill? Okay, if I'm on the treadmill and I'm holding on like this and I'm going like this for 40 minutes, 3 times a week, what do you think my posture is going to look like? And then I wonder why I got rounded shoulders, all right? Oh, but doctor, if I don't hold on, I can't go as fast. Well, excuse me, what does that tell you? It tells you you're going too fast. So slow it down, correct your posture, and reinforce proper posture while you're on the gym. I had a gal in 2 weeks ago, pain in her wrist, arm, and shoulder, all right? Carpal tunnel syndrome, maybe. We're going through her history, we're going through the exam. How does she exercise? Every day she's on the stepper. Like this, arms on the stepper, pushing down like this. No wonder her wrists are killing her, all right? So you gotta have proper posture. First you need to learn it, then you need to have the flexibility in those joints to maintain the position, and then you need the strength of the muscles to hold you there. That's my job, to structure your exercises and to give you the tools to do it. Then it's your job to reinforce it. Sitting at work, in the gym, walking around, going shopping, with your everyday activities. It's up to you to reinforce it. I can just give you the tools. With better posture, you're going to breathe better, you're going to feel healthier, you're going to have better motion, you'll be taller, you'll be thinner. It's a great choice. In the beginning of the show, we talked about exercise for posture. We're going to go right now into my top exercises to improving the posture of the most common distortion is the upper cross postural distortion. So we're going to go over the top exercises and how to do them properly, and then you can empower yourself with doing these at home. And then remember, it's a lot of information. If you have any questions, you can call me. If you want the exercises, just email me, drdefabio@aol.com. I'll just send them right back to you. The bottom line is better posture is better health, and it reduces spinal decay. So let's take a look at these exercises, and then we'll wrap it all up. Now we're ready to go over the top 4 exercises to work on your upper cross postural distortion, or what we call anterior head carriage. The first exercise is to stretch the chest. So James, let's show everybody a nice comfortable chest stretch. Interlace your hands behind your back, lift up with the arms, shoulders stay back and down to open up the chest. Is it the only exercise? No, it's just the one that I like the best. The second exercise, relax, is to get that head back and get the ear over your shoulders. Remember we talked about those landmarks? Ear over the shoulder, shoulder over the hip. Let's go with the cervical retractions. Take a red TheraBand. It's not about resistance, it's about control. These are postural exercises. And cervical retractions. Pull back, hold, and release. The cadence I want you to use on this is a tempo of 2-second pull back, 2-second hold, and a 4-second relax. And if you notice, the chin stays nice and level. That's to get the head back, to get that ear over the shoulder for that proper plumb line, all right? That's the second exercise. Very simple with the TheraBand. The third is what they call Brugger's phasic exercise. Excellent for the upper cross to hit those mid and lower traps. Open palm with the TheraBand. Wrist goes back, fingers extend. Elbows are tight. Pinch the shoulder blades back and down. Turn out, stretch out. Looks really simple, and slowly come back. Same thing, wrist goes out, fingers go, turn out, push out, hold 1, 2, slowly come back on a count of 4. However, the key is when you look at the back. Turn around. Let's watch the exercise from the back. Do the Bruggers again. Watch this area. Pinch, turn in, go out, hold that for a second. Look how soft these muscles are. This is the key. These muscles have to be soft. These muscles have to be strong. That engages your mid and lower traps. Relax. Do it again, but engage your upper traps. This is the way most people do the exercise. Look how hard those muscles are. Wrong. Doesn't work. Relax. Just do cervical retraction. Just come straight back. Most people do that, and you can get relaxation. But anytime you contract here and pull up, that we want to avoid. All right? So the key with the Bruggers, one more time, James, properly, is to pinch and to push out, keeping these relaxed. The fourth exercise is a seated row, or you can do a squat to row, or you can do a standing row. Let's set up for some seated rows. Again, the rows are all about mid and lower trap strengthening. Pinching in here, nothing here, and slowly release. I like to call this a 4-step row. Start from the very beginning. Step 1 is to engage. Step 2 is to pull the arms back. Look how loose these are. Remember we talked about how important that is? Step 3 is to keep these engaged, relax the arms, no tension, no tension. And step 4 is to release. Now, can you keep this contracted and tight the whole time? Yes, you can. Do it tight, hold, and go, and give me several reps. Now, he can hold this tight the whole time, keeping this loose. The key, I can't overemphasize it, is to keep the upper traps loose while you're engaging the mid and lower traps. Those are the top 4 exercises. If you want a PDF version of that, just email me, drdefabio@aol.com, and I'll send it off to you. That's the best way to prevent postural distortions of the upper extremity. The only thing you need to add is to foam roll the thoracic spine to open up the extension, and if it's really stiff, you need chiropractic adjustments to create the flexibility of the spine so the exercises will do their job. You know, today's show was a lot of information. We talked about all the different postural distortions, the most common 3, upper, core, and lower. We gave you some exercises. The key is you have to work on it. We also talked about maintaining proper posture and alignment in your everyday activities. You have to reinforce this. Everything you do has to be about posture. Why? Because you'll be healthier and it prevents spinal decay. After all, where are you going to live when your spine wears out? So you got to reduce spinal decay. If you have any questions, contact me. I'm not going to give you my email address again. You know where to find me. I'm Dr. Donald DeFabio. Thanks for tuning in, and we look forward to having you visit us on our next show. And remember, keep up with better posture. Come on, James, let's do some more exercises. Hi, I'm Dr. Donald DeFabio with your wellness tip. Did you know that your diet directly impacts your health? We know certain foods will drive inflammation. That causes pain, that causes disease. We know certain foods will suppress inflammation. You can eat an anti-inflammatory diet very easily and enjoy all the foods that you like, and it can be healthier for you. So an anti-inflammatory diet is directly related to decreasing inflammation in your genetic expression for disease. If you want more information about the anti-inflammatory diet, email my office, call us, and ask for the Nutritional Foundation. It's all right there. An anti-inflammatory diet's a lifestyle that decreases pain and it gives you your life back. I'm Dr. Donald DeFabio, and that's your wellness tip.